You're listening to Soundside. I'm Diana Opong. A quick warning before we get into this next segment. We're going to be talking about suicide. This week is National Suicide Prevention Week. Deaths by suicide in young people have risen by more than 60% in recent decades. And in 2022, it was the second leading cause of death for people aged 10 to 14. Behind that tragic statistic is a lot of nuance, though. For example, Alaska Natives, American Indians, and white youth are more likely to take their own lives than their Asian American peers. But my next guest says even that statistic masks the reality of suicide rates in Asian American young people, and that rates vary greatly by subgroup. He believes by better understanding the background of individuals at risk, we can develop culturally specific and more effective approaches to youth mental health care. Dr. Anthony L. Bowie is the lead author of a study that looked at suicide rates in Asian American youth. It was recently published in the Journal of the American Medical Association Pediatrics. Dr. Bowie is also an acting assistant professor of pediatrics at the University of Washington School of Medicine and a researcher at the Seattle Children's Research Institute. Dr. Bowie, you are keeping yourself busy. Thanks so much for being here.
Oh, thanks so much for having me on, Diana. I really appreciate it.
So, just to start out with, you're a pediatrician and you work with and research young people's health. What are you seeing right now when it comes to the mental health of youth?
Yeah, so what we do know is that since the pandemic, mental illness has really increased. So social isolation during that time was really, really challenging on youth and families. And even still, a lot of the adjustments from pandemic are impacting the mental health of our kids every day.
What prompted your interest in doing this study on suicide in Asian American communities right now?
So as a primary care pediatrician, I'm really privileged to care for many immigrant and refugee families. I'm the son of Vietnamese refugees myself. And I've noticed that a lot of the kids that I have the privilege of seeing are expressing more and more mental illness symptoms. Something that has come up actually out of others' research is that suicide is actually the leading cause of death for Asian American youth. And so that's what prompted me to do this study.
That's a very striking bit of information, right? When you've discovered that, how did it make you feel?
It's of course really concerning and really disturbing that suicide rates have just started to climb in these communities. And I think one of the things that people less familiar with this data will say is that, well, Asian Americans don't have that high of suicide rates compared to other groups. But actually, when we start to disaggregate them into these more specific subgroups, we start to see there are pretty stark disparities within those groups.
How did you categorize Asian American youth in the study, and why did you choose to break the data into those subgroups?
There's a large movement right now to disaggregate Asian American data because we know that specific ethnic groups have unique and diverse stories within them. That's also true here in looking at suicide rates among youth and young adults. And so I thought it was really important to look at not just Asian Americans all lumped together, but also trying to break them out by their ethnicity.
Yeah, I think it's easy in our culture to make everybody like some type of monolith, right?
Right.
All Asian people, all African people, all Europeans, all South Americans. Each of those communities is their own different thing. I mean, there's different languages, different foods, cultures, traditions. There was an all other category in your study. Who is in that category and why did you use it instead of using more subgroups?
Yeah, so what our study was able to do was break up Asian Americans into the largest Asian American subgroups. So that included Chinese, Filipino, Indian, Korean, and Vietnamese. But unfortunately, due to the limitations of the national mortality data, we weren't able to continue to break them up into even further narrower groups. The other ethnic groups that are in all other Asian Americans include ethnic communities like Bangladeshi, Burmese, Cambodian, Hmong, Japanese, Laotian, to name a few.
What were the findings of your study?
So one of the biggest things that we noticed was that there were large differences across the different Asian American subgroups. So for example, when we were looking at youth suicide rates, we found that Vietnamese actually had disproportionately higher suicide rates compared to other Asian American subgroups. So in particular, they had 10.57 deaths per 100,000 individuals compared to Indians who had 6.91 per 100,000 individuals. So there's a pretty stark difference between those two groups, for example. And what this really highlighted was that by lumping all of the Asian Americans together, that really masks some of these important disparities that are important to recognize so that we could prioritize interventions and attention to the right communities.
As a son of Vietnamese refugees, were you surprised to see that Vietnamese American youth had the highest rate of suicide of the groups that you looked at?
I'm one of the few Vietnamese Seattle primary care pediatricians, and so have the privilege of seeing many Vietnamese patients and families. Even with this, I knew that mental illness was really prevalent in these communities, but I was still somewhat surprised to see that it was so much greater compared to some of these other groups.
Do you know what's causing the variation in suicide rates among Asian American subgroups, especially the Vietnamese?
So in terms of what's causing the variation, I'm not too sure, but have some guesses. I know as a whole, Asian Americans have experienced a lot more anti-Asian hate and xenophobia over the last few years, especially during the pandemic. There's been increases in societal pressure to succeed. We know that the model minority myth is a myth in itself, but actually does have really harmful effects on Asian children and teenagers. And we also know that Asian Americans use mental health services much less than any other racial group. And I think that's a contributing factor due to barriers like stigma or language or socioeconomic status that might prohibit kids from seeking out mental health care. And the last really striking thing explaining why Asian American suicide rates are going up is there's been an increase in access to firearms. Historically, Asian American youths have died by suicide from mostly suffocation, which is still the predominant cause, but we've actually seen a higher number of deaths from firearms. And I think that's because access to firearms is going up in our country.
So, what I'm hearing you say, Dr. Bui, is that the rates of death amongst Asian American youth is increasing since the pandemic, just sort of
Right,
like year over year.
right.
Oof. As a parent, that's just really hard to hear. And it's sad to know that kids are still struggling and not getting the support that they need, which is one of the reasons why you wanted to do the study, to figure out what we can do to provide culturally appropriate and relevant interventions. So this study provides more granular information about who is at risk for suicide. How do you anticipate that this information will be used?
As a pediatrician myself, one of the things I think about is how do we increase access to culturally relevant and responsive mental health care services for these different communities. And so by knowing that Vietnamese and other Asian American groups have higher risk of suicide, that's a start to help prioritize resources for those communities. But really, even though there have been some wonderful institutions and individuals who have been leading the way in increasing culturally responsive mental health care for Asian Americans, the need and the demand for these services has far outstripped what's really available. And so I'm hoping that this work prioritizes more resources towards mental health for these communities and is also influencing even the directions of research that I'm going in as well, where I'm hoping to really understand how to improve access for these kids.
This study stresses the importance of healthcare that doesn't lump people under large groups. Blunt
Mhm.
labels like Asian American, and it points to the necessity of medical care that is culturally appropriate. What might
Right.
culturally appropriate care look like in practice?
To me, culturally appropriate care will take into account a family's language, their understanding over mental health and other related conditions, the types of other services that are provided to them that they're familiar with. For example, I know in my own family growing up, herbal and complementary practices were really important in our family. And so having a good understanding of these different practices and using appropriate language is what's key here. The other thing to note is that in many languages, words around mental health are still either unavailable or inexistent or just highly stigmatized. And I know within my own culture, that's certainly the case in Vietnamese. And so being aware of those different language barriers, not just because they're a different language, but because the use of the words are not that common, reframing that for families and having that empathy that takes some time is really crucial here.
Yeah. And I'm an immigrant to this country. And so for me, I know culturally it is not common. I don't know a single Ghanaian therapist, that currently lives in Ghana and is practicing kind of thing. Like, I don't think there's a mental health care industry, at least not that I'm aware of and that my parents ever talked about. And the
Right.
one time it was suggested, as a family when we first moved here to like help sort of acclimate us with a counselor, my parents were very resistant to it. And
Right.
so I think that, like you said, culturally, if that had been approached with, hey, I know that this isn't your guys' thing, obviously not like that, but I think
Yeah.
my parents might have been more open to it, but they went once and never again because they were like, oh, who is this person? Why are they talking to us? What do they know? Like you said,
Right.
there's a stigma, and just culturally, these are also not things you really talk about. You don't talk about your feelings, you stuff it in, you do your job. And
Right.
there is that immigrant myth as well, right? Of like, you need to work hard. And because you're brown, you have to work even harder and
Right.
study hard, blah, blah, blah. And so, again, that pressure is real, especially for young people. So,
Yeah.
I want to know, what does intervention look like currently? And how is it underserving youth of color, separate and apart from the fact that there just aren't as many therapists of color?
Really, there just aren't enough therapists around for the whole population of youth. And so there's really long waiting lists for any youth to access the mental health care that they need. And while our schools and school-based health centers and primary care clinics, I think the larger network is trying hard to provide appropriate mental health care to youth, the need is just so high right now that I think we need to think about other solutions and other alternatives. That said, what I realize is that sometimes when we focus on the larger population about offering these other solutions and alternatives, that if we don't think about those who are most impacted by this disparity, that those groups tend to get left behind. And so I think the research that we're talking about today really highlights the importance of thinking about these communities and putting them at the forefront of our plans.
Suicide is tragic for families and communities. Many people have lost loved ones to it or know someone who has. And unfortunately, it's a thing that is really scary for people who are parents or caretakers. So, what can they take away from your study? What should they know?
My study doesn't necessarily address what are the interventions or what are the treatment options, but I could speak as a pediatrician. First, it's really important to talk to your child and truly listen. We want to make sure that parents, teachers, guardians, loved ones are watching for any major changes in their kids' behavior and their sleep and their appetite, how they're doing in school and in their social activities, because those might be some silent alarms that we need to pay attention to. So, secondly, I think it's important for parents and families to create a safe space for kids and teens to express themselves. This could mean being empathetic and not having judgment when you're talking to them and exploring how they're feeling. Third, I think it's important to remember to seek out and ask for help when, as parents or families, that you don't have all the answers. So reaching out to your primary care provider, talking to your school therapist, even calling the national hotline, which is 988. Those are all really important things to think about and consider as you're considering asking for help.
Yeah,
Uh,
I don't think I considered as a parent that you could call 988 for advice. I thought it was
right.
for someone who maybe was already in crisis.
Yeah. Um, I also think, if you are in the unfortunate situation where you're worried about a child who has mental illness, it's time to start thinking about locking up or even better, eliminating firearms from the household if any exist. My recommendation is to remove all firearms from the household, no matter what. But if that's not possible, the second best thing is locking them up, unloaded, and ammunition in a different lockbox and removing and locking away any other things that could be harmful to the child. I think those are just really important things to reduce potential harmful activities and behaviors that the child could take on. And then lastly, just really focusing on daily activities, improving sleep and exercise, reducing screen time and reducing time on social media. I think all of those things generally would improve your mental health, not just your child's, but the adults too, and so the overall family. So I think those are all things to prioritize.
Yeah, I think you're hitting on so many things that parents know, but sometimes are really hard to implement. We're all on our phones. We're then modeling that for our kids, that it's okay to be on your phones and on screens. Dr. Anthony L. Bowie is an acting assistant professor of pediatrics at the University of Washington School of Medicine and a researcher at the Seattle Children's Research Institute. Dr. Bowie, thank you so much for your time and for your research.
Thanks so much.
During our conversation, Dr. Bowie noted the importance of reaching out to professionals like school therapists when you're concerned about youth in your life. Soundside called up one of those school-based child mental health specialists to learn more about what culturally appropriate healthcare for young people may look like in practice. Anna Short is a child mental health specialist with Internal Community Health Services. For almost 5 years, she's been based in a clinic at Seattle World School.
Our school is for newly arrived immigrant and refugee youth.
The school serves students from around the world, mostly from Latin America and Asian countries, including Vietnam, Cambodia, China, and Japan. With such a diverse student population, the school and the clinic prioritize being culturally responsive. Short says to help cross language and cultural barriers, the clinic has brought on patient navigators who reflect the student population. One of the navigators is Vietnamese American.
Not only is he identifies as Vietnamese, but he speaks Vietnamese. Also, he went to this school, so he understands like what it's like to be, an immigrant, to be at a new school, to navigate large systems. And so my work with him has been tremendous. His being present in the room with me has made a difference, has engaged people in the conversation. It also allows for people to come back and address their behavioral health needs, which has been huge for my work.
Short says getting students from diverse cultures to be more comfortable with seeing mental health care often takes time and care.
I have to start slow and meet them where they're at. So sometimes that's making connections. I have the ability, that's the beauty of school-based. I am embedded into their day. They see me Monday through Friday. They see me in the cafeteria. They see me in the hallways. They see me in the classroom. Sometimes I do classroom presentations. Sometimes I do like lunch presentations. I'm at events like multicultural night. So I'm getting to know them and their families. I think that's the important, is making those connections before anything else starts. I'm making those connections. That's huge.
She says they also look for ways beyond talk therapy to help students. For instance, loneliness is a real issue for youth that have left their home countries behind. So the school has organized outings to help familiarize the students with their new home.
I had some funding to show them Seattle. So we rode the bus, again, showing them how to ride the bus. It's a huge thing for a young person. But then we also showed them sights of Seattle. We went to all these different places locally, just so they felt not only connected to other students and to our clinic staff, but also to their environment, their community, the Seattle community.
And having a supportive community can be both life-changing and life-saving for young people. Going forward, Short says she's hopeful that they can connect students with more community-based organizations, something that would allow them to exercise mental health outside of school. Thanks for listening to Soundside. This show is only possible because listeners support us. If you're able to give right now, please head to KUOW.org/donate. Oh, and don't forget, you can listen live on KUOW 94.9 FM Seattle at noon and 8 p.m. Monday through Thursday, or anytime online at KUOW.org, on the new KUOW app, or wherever you get your podcasts.